Hey everyone, welcome back to the Fresh Vitals channel. Navigating a cancer diagnosis or helping a loved one through it can feel like you're just drowning in medical jargon. It's overwhelming, right? So today, we're taking a deep breath and doing a straightforward deep dive into a really crucial cancer treatment. It's called Imatinib, though you might know it by its brand name Gleevec. We're going to break down exactly what it is, how it works, and most importantly, how you can confidently manage your daily routine while taking it.
So imagine for a second, what if a cancer treatment could target the disease directly at the cellular level? I mean, for decades, traditional chemo is kind of like a blunt instrument, right? It attacks rapidly dividing cells all over the body, which, as we know, causes some pretty harsh systemic side effects. But Imatinib, it's a total game changer. It's part of a class called targeted therapies. Think of it like a highly trained molecular detective. It actually seeks out and shuts down the specific culprits that cause these cancers to grow, while pretty much leaving your healthy cells alone.
Here's our roadmap for today. First, we'll look at what Imatinib actually is. Then, we'll talk daily dosage, managing side effects, and finally, the essential precautions you and your doctor need to take.
All right, let's jump straight into Section 1. What exactly is Imatinib?
Okay, so you'll hear the term kinase inhibitor, but what does that actually mean? Well, in plain English, kinases are proteins in your body that act like little on-off switches for cellular functions, like cell division. Now, in certain types of cancer, a genetic mutation creates this rogue kinase that gets completely stuck in the on position. It's literally just constantly screaming at the cancer cells to multiply. What Imatinib does is physically bind to these specific abnormal proteins, like the BCR-ABL tyrosine kinase, and totally blocks their signal. Basically, it just pulls the plug on the machine, stopping those cancer cells from multiplying and actually forcing them to die off.
Because it's so hyper-targeted, Imatinib isn't just a broad-spectrum cancer drug. It's prescribed for very specific conditions where these rogue proteins are actually present. The main ones include Philadelphia chromosome-positive chronic myeloid leukemia, or CML, which is a disease of the blood and bone marrow. It's also used for KIT-positive gastrointestinal stromal tumors, mostly known as GIST, and Philadelphia chromosome-positive acute lymphoblastic leukemia, plus a handful of other very specific blood and bone marrow disorders.
Moving right along to Section 2, dosage and your daily administration routine.
So, getting the dosage right is absolutely crucial here. For most adults, the standard starting dose is going to be somewhere between 400 to 600 milligrams a day, depending on if you're treating CML, GIST, or something else. But keep in mind, your doctor might need to tweak this. Sometimes, if the disease is progressing, they'll bump that daily dose all the way up to 800 milligrams. And if you do get prescribed that higher 800 milligram dose, you're generally going to split that into two 400 milligram doses taken twice a day.
Now, mastering your daily routine is the secret to avoiding an upset stomach with this med. Step 1. Always take it with a full meal. Step 2. Wash it down with a big glass of water. And Step 3, and honestly, this is such a brilliant tip if you hate swallowing huge pills, you actually don't have to swallow it whole. No way, right? You can literally just drop the tablet into a glass of water, or even apple juice, stir it with a spoon until it completely dissolves, and then just drink it right down. It makes the whole daily routine so much easier.
All right, let's look at Section 3, preparing for side effects.
Look, the reality is most folks taking Imatinib are going to experience some side effects. But the good news? They're usually mild to moderate. The really common ones are things like nausea, edema, which is swelling, muscle cramps, diarrhea, and fatigue. Super frequent, but totally manageable. On the flip side, though, we do have to talk about the rare, severe side effects. We're talking severe fluid retention, liver toxicity, and potentially gastrointestinal hemorrhage. Knowing the difference between the two is huge because it empowers you to know what's just part of the normal process and what means you need to call your doctor right away.
I actually want to pause for a second on the edema factor, because this is probably the most common thing you're actually going to see in the mirror. Fluid retention usually shows up as superficial swelling. A lot of times it's right around your eyes, we call that periorbital edema, or down in your legs and feet. I want to reassure you, this localized swelling is incredibly normal. It's a totally expected reaction, and honestly, your doctor can usually manage it pretty easily with a slight dosage adjustment or maybe some mild diuretics to help flush that extra fluid out.
Okay, bringing us to our final part, Section 4, precautions and doctor guidance.
So, the FDA prescribing guidelines for Imatinib state exactly this. Perform complete blood counts weekly for the first month, biweekly for the second month, and periodically thereafter. Why is this so strict? Well, because this drug goes to work right inside your bone marrow, it can cause cytopenias. That's just a fancy medical term for a drop in your essential blood cells. So your white blood cells, red blood cells, or platelets. Doing these strict blood tests is absolutely non-negotiable, so your care team can catch any drops super early and adjust your treatment if they need to. Just to really hammer this home, you've got to plan your schedule around seeing your doctor exactly 1 time per week during that crucial first month of treatment. Yeah, I know, it's a bit of a time commitment right out of the gate. But honestly, it's the best way to ensure your body is safely handling the medication while your system adjusts.
Beyond the blood counts, there are a few other big precautions you need to be actively involved in. First up, your doctor is going to test your liver function before you even start and then every month after that just to rule out any liver toxicity. Second, make it a habit to step on the scale regularly. If you see sudden, rapid weight gain, that's a massive red flag for severe fluid retention, and you need to let your doctor know immediately. And third, this is absolutely critical. You must strictly avoid getting pregnant while on this. Imatinib is a Category D drug, which means it can cause very serious harm to a developing baby.
So I want to leave you with this thought to chew on. How will mastering the routine of targeted therapies like imatinib actually empower your cancer journey? When you really understand how this drug works, when you've got your dosing steps locked down, and you know exactly what side effects to watch for, you stop being just a passive patient. You become an active, empowered partner in your own healing process. If this explainer helped clear things up for you today, please do us a huge favor and support the Fresh Vitals channel. Hit that subscribe button, drop a like, leave a comment below sharing your own experiences, and definitely share this video with anyone who could use this info. Stay informed, stay empowered, and we will catch you in the next explainer.